There are two kinds of cardiologists, vegans and those who haven't read the data.
No, I don't really think that's a scientific statement.
A whole food plant-based diet is the only way of eating that has ever actually shown the ability to reverse heart disease.
Is a plant-based diet the only one that reverses heart disease, and does it really do it? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional information online. In this video, we're going to go into a deep dive of the evidence for plant-based diets reversing heart disease. And there's some really important lessons to be learned here about science and about the teaching of information. Stay tuned to the end of the video where I give my final thoughts. So this is a university lecture, although at a university, it's from someone who works at the McDougall program, I believe. And McDougall is actually McDougallers are ones who follow the McDougall diet, which is an ultra low fat kind of diet. And so if anything, I might suspect there's a bias toward ultra low fat diets, but that's just my hunch. I'd like to take a moment to thank our friends over at Element or LMNT.com. A great electrolyte supplement, specialized formulation, scientifically backed with sodium, potassium, and magnesium. Lots of different flavors, and it's useful if you're starting a keto diet to reduce or eliminate the keto flu or keto adaptation that we call it. Or it might be useful down the road if you're not feeling like you have enough energy. Often on a low-carb diet, the lack of energy is not from no sugar, it's actually from low blood pressure or not enough salt in the diet. So be sure to check out the website and the link that we have here. If you go to drinklmnt.com/Eric Westman, they're offering you a free sample pack with any purchase, but you have to click on that link to get that free sample pack. Enjoy.
A whole food plant-based diet is the only way of eating that has ever actually shown the ability to reverse, which as I mentioned is the #1 killer of men and women in the United States and globally. And the one who really sort of showed the potential for this is Dr. Dean Ornish, who I mentioned earlier. He is a professor of medicine at UCSF. He's famous for this lifestyle heart trial, and he was on the cover of Newsweek actually for his work in this area.
So just a moment about diet doctors and all that. You know, in some spheres, I think there's too much of an emphasis on the people. I want emphasis on the science, the drug, or the diet, or whatever the science says. So when you start getting into this sort of almost glorification of people, that's a problem. It happens really everywhere, right? The Atkins diet, Dr. Atkins was kind of glorified by a lot of people, although that's the approach that I learned. And then if you haven't watched my videos before, basically the science supports what Dr. Atkins was saying. About that same time, Dr. Ornish, though, was the first one to do a study on a diet and reversing heart disease or addressing heart disease. So you got to hand it to Dr. Ornish for putting lifestyle on the map. The problem, as you're going to see in this video, is, well, let's see how it goes.
And this was back in the 1980s to early 90s, where he took, RCT stands for randomized controlled trial. It's sort of considered the gold standard of medical research because he took 48 patients with moderate to severe CAD, which stands for coronary artery disease or heart disease, and he took half of them and put them on the American Heart Association diet. So they continued to receive care from the cardiologist and ate sort of an American Heart Association healthy diet. The other half of the group, he put on a whole food plant-based diet with other lifestyle changes like meeting in a group on a regular basis, so connecting with each other, thinking about stress reduction, and getting some moderate exercise. What I appreciated about his approach, because he has since gone on to replicate this intervention in other areas, including prostate cancer, including Alzheimer's. And he does not change the intervention. It is a multi-part intervention that includes not just a whole food plant-based diet, but these other aspects of movement, stress reduction, and connection with each other.
Well, so let's pause right here. If you're designing a study to reverse heart disease, if you're using a drug or other sort of intervention, 48 people, if you consult a statistician, and I have a master's degree in statistics, was trained in clinical trial development, I wrote my own clinical trials for a long time, that's not many people. So to have 48 people and then you randomize them to 2 groups, that means you have 24 people per group, which means you have to believe your intervention is going to be really potent. Like, you know, that's almost night and day with that intervention with only 50 people. Now, I've designed clinical trials where low glycemic and ultra low carb or low carb ketogenic, in 50 people, we were able to show a difference in hemoglobin A1C, which is a measure of blood glucose. And so that makes sense that you lower the carbs even more, you can lower the glucose. And that was over 6 months in only 50 people. But here we're talking about, you know, coronary artery disease, which is a harder thing to change than an A1C or blood glucose, it's thought. So I don't think this study would be funded, is what I'm trying to say, with so few people. And it was, I remember when this came out, I was in training at the time, and it was kind of a shock. And the main message here is the hallmark of science is replication. And it's interesting, Doctor, in this presentation already has said replication in different diseases. So the term replication, I think Dr. Ornish may have been given some feedback that, you know, you really have to replicate the study. What they did is they did a demonstration project. They never really did another RCT, to my knowledge, to replicate this kind of research. So the design is criticized by today's standards that it's too small to really find a difference. And even if it did show a difference, you have to replicate it, show that you can reverse the atherosclerosis here, or coronary artery disease, or outcomes. In fact, most people wouldn't just rely on the arteries anymore. You'd have to get the outcomes of heart disease, death, dying, heart attack, hospitalization, that sort of thing. So through today's, you know, the retrospectoscope, this study, it would be kind of a preliminary case, you know, proof of concept sort of thing, not a definitive thing. But now, how many years later, it's being used as the hallmark study that supports the reversal of heart disease by plant-based diets. You would think by now that there would be umpteen other studies that have been done to replicate it, to show it, and that it would be in the medical world. Well, you could claim that the pharmacologic bias of the medication world today limits that, and I think that's a valid argument. But let's see what this study actually showed.
What was really neat to see is that in the intervention group, it's not that the percentage of stenosis went to 0, because there is a certain amount of plaque that blocks the arteries that almost becomes sort of like scar tissue, right? So it's just not going to go away. But there's also what's called soft plaque, and that's really where there's possibility for improvement. And so what we actually see is that the average in the intervention group went from 41% blockage down to 38.5, down to 37.3%. So in total, the amount of narrowing improved by 8% over 5 years in the intervention group, and in contrast, it worsened by 28% in the control group.
So just looking at this graph for a moment, everything that he said was true. That there is really no change in the treatment group, no progression, a change from 40 to 37 because those bars overlap, the confidence limits or confidence intervals, whatever they use. That means it wasn't statistically significant, but still that's great that there wasn't a change in the treatment group. And there was a change in the control group, meaning the ones who didn't get the intervention. But the limitation here is the number of people and also the methodology. By today's standards, most people don't use the coronary angiogram, which is what they used at the time, although I think it's a valid way to do it. But the main kind of head-scratching thing is, why hasn't this been replicated over and over, and why don't we see cases of people in case studies, case series of people having improvements left and right? We're going to see at least one case, but the hallmark of science is replication, and this study, however important it was to put lifestyle on the map, is really too small to say that you should change a policy, I'm afraid. Why would a small study not change policy? Well, what was the demographics of those chosen for the study? What were so there's a wide variety of types of people, and to make a policy, you want to have studies in a wide range of people. So this would be seen as a pilot study, not the one to lead your talk about how great plant-based diets are. I mean, I'm sorry, it's such an old study too, that by today's standards, it has many limitations.
And then what is also interesting is to note that it's not an all or nothing proposition. And this really is one of the major points that I want everyone to come away with, is that you don't have to go all the way. Whatever you can do at this stage after this talk in a healthier direction, let's start there. Because what we see is that even the least adherent group still had some benefit in terms of the stenosis. But the people who did the most had the most benefit.
Now, do you look at the figures here and the columns at the bottom where it says N, that's the sample size. So we're talking now a very small number of people. I mean, it's great to show, but it by no means definitive. I think this one is 6, N equals 6 means 6 people in that group.
This is Dr. Esselstyn. He has sort of added to this concept of reversal of heart disease through a plant-based diet through his own research. He's a surgeon at Cleveland Clinic, and he worked with a small group of patients. This is the actual angiogram from one of the patients that he worked with, the distal LAD, the left anterior descending artery. And you can see how it kind of gets a little narrow towards the end. This is called the widowmaker artery for a reason. Well, 3 years later, after eating a plant-based diet, I don't know if you can tell, but it has opened up considerably. And so one of the books I highly recommend that you look at, especially if heart disease affects a family member or yourself, is his book, Prevent and Reverse Heart Disease.
So Dr. Esselstyn, if that's the most information that's been published, it's really not very much. And now I'm not saying that there's a lot of information about low-carb diets that are published with this kind of data either. But there is an ongoing study right now of people with super high LDLs on low-carb diets where they're getting CT angiograms serially. So they're going to be done at least 1 year at one baseline and 1 year into it. And that will put 80 to 100 people on the low-carb, what happens to their coronary angiogram based on a CT angiogram. I'd like to see that for the plant-based diet kind of world. I've never seen that kind of study. CT angiograms are non-invasive. They're relatively inexpensive compared to heart catheterization. And you would need that sort of level of evidence to make a policy change. Even at an organizational level, you would want to make sure that you have, 20, 50, 100, a diverse kind of population to show a benefit before you say this is the best diet for anyone. And of course, if you don't compare it head to head to another type of diet other than the American diet, you can't say your diet is better or better than any other diet other than the one you studied until you test them head to head. So it's great that there's a university professor pushing a program that apparently helps people. It's great, but the data so far not so strong, and then there may be more than one way to do this.
Dr. Kim Williams is the former president of the American College of Cardiology. He's currently a head of cardiology department at Rush University Medical Center. So he's very much in mainstream medicine. And when years ago he learned about the power of a whole food plant-based diet, just like me, he has now since come out and said things like this: wouldn't it be a laudable goal of the American College of Cardiology to put ourselves out of business? That's not my quote, that is his quote. There are two kinds of cardiologists, vegans and those who haven't read the data.
No, I don't really think that's a scientific statement.
So yes, you may have a predisposition towards heart disease or towards stroke or towards some autoimmune, but don't underestimate the power of radical lifestyle change to make it so that those genetics never fully express themselves.
I totally agree with that. So actually there's so much in common about a vegan, vegetarian, McDougall type of program and a low carb, even Atkins, if you want to trade names there, because there's the absence of ultra processed food, the absence of a lot of sugar and refined flour and starch and ultra processed food. So there's a lot in common. And to have people say that this is good, I have no problem with that, although I'm crying out for a little more data, please. But if you've had benefits eating this way, I wouldn't say don't do it unless you're showing evidence of the disease, or if you're. I've seen people gain 50 pounds on a low fat vegetarian kind of diet, and they never suspected the diet was the cause, because they were always taught that the diet was healthy. People eat fruit all the time, thinking that's not a cause of gaining weight, when actually it does contribute to that. So anyway, this is fascinating, and I think we all agree here that lifestyle is potent and is powerful.
I have seen it again and again and again. And Dr. Williams had that aha moment where he realized that his genetic history did not determine his fate. He has since seen a significant drop in his cholesterol to optimal numbers and seen how lifestyle really overcame his genetic makeup.
So I would like to shade his statement and say there are those who are science evidence-based, who address lifestyle, those kinds of cardiologists, and then those who don't. And I don't think you have to eat the way that you tell people to eat. I think you don't have to have had heart disease to be able to help someone with heart disease. That's a false expectation that you're going to have to get a recommendation from someone following that diet, or that's don't be so hard on your doctor about that. But if your doctor is telling you the plant-based way is the only way, they're falling victim to the single-minded thinking that there's only one way to go about this, when there are actually many ways.
This is Jose. This is a picture I just took Tuesday of this week. I said, Jose, I've got to capture this because your story is just too good to tell. So his doctor basically said, you're headed for transplant. On top of that, he had uncontrolled diabetes with a hemoglobin A1C, which is what's considered an average of your blood sugars for the last 2 to 3 months. 6.5% is the criteria for diagnosis of diabetes. His hemoglobin A1C had gotten as high as 10.9%, which is considered poor control. On top of that, he was on 18 to 20 units of long-acting insulin with, I think, 5 to 10 units of short-acting insulin with each meal when I saw him. Guess how much he's on now? 0. So he has a hemoglobin A1C that is well below not only the threshold for diabetes, the threshold for prediabetes, with no medication, with kidney function that essentially has gotten him off the kidney transplant list, and off 2 of his blood pressure medications that he came in on.
I have no doubt that can happen. I see it in my clinic as well, and any other treatments that are that powerful. I'm reminded of the weight loss surgeon focus. They for years they would say they're the only kind of program that leads to weight loss. Well, that's clearly not true. For a while, they would say weight loss surgery is the only thing that reverses type 2 diabetes. There's a classic paper, what if type 2 diabetes is a surgical disease? Well, no, you can change your lifestyle, you can use medications, you can do other things as well. So I love the presentation that lifestyle is powerful and can have all of these different effects. And I have to give credit to Dr. Ornish for putting it on lifestyle on the map. The limitation, however, is, and Dr. Ornish's contribution to the limitation is that it's not the only way to do it. And so when Dr. Ornish for years would say, there's no evidence for anything else, he was basically talking about that 48 subject study of his evidence, which is by today's standard, not very sound, not solid. So I would urge any lifestyle kind of program to pony up the money, do a GoFundMe, and do coronary CT angiograms like Dave Feldman and the Citizen Science Foundation is doing with low-carb diets, even in the context of super high LDLs, and see what the CT angiograms do over a year or 5 years. These are not difficult studies to do. When you do those studies, you're going to get the attention of the mainstream medicine folks who are using medication and not even talking about diet or lifestyle in my sphere where I am. So plus and minus on the video here, but lifestyle is very potent. And if you can choose one of many different types of lifestyles and choose one that you see that improves your health, it doesn't make it worse. I hope you like this one, and if you like, please like, subscribe, ring the notification bell. I'm putting out new videos every Wednesday and Friday.